There are certain subjects many men are curious about but rarely feel comfortable discussing openly. They may hear fragmented advice from friends, encounter conflicting information online, or carry quiet questions into long-term relationships without ever seeking clear medical guidance. One of these topics is anal intimacy, an area surrounded by both curiosity and misunderstanding. For some couples, it represents exploration and closeness. For others, it raises concerns about safety, comfort, and potential long-term health effects. Understanding the medical realities behind this form of intimacy can help men make informed decisions that protect both confidence and well-being. Before we explore this important conversation together, take a moment right now to hit the like button. Comment below where you are watching from. And subscribe so you never miss practical health strategies that could help you avoid unnecessary complications later in life. Hello, gentlemen. I'm Dr. Hannah Cole. Over the past 2 decades, I have worked with men navigating a wide range of sexual health concerns, from erectile confidence and prostate well-being to hormonal transitions and the evolving nature of intimacy as the body ages. One of the first principles to understand about anal intimacy is anatomical sensitivity. Unlike other areas of the body, the anal region does not naturally produce lubrication. This means that friction can occur more easily, increasing the likelihood of small tissue tears if adequate preparation is not considered. These microinjuries may not always be immediately painful, but they can create pathways for irritation or infection. Gentle pacing and appropriate lubrication are therefore essential components of safer practice. Another important factor involves muscular structure. The anal sphincter is designed primarily for control rather than expansion. Sudden or forceful penetration may trigger involuntary tightening, leading to discomfort or even longer-term muscular tension patterns. Gradual relaxation and communication between partners can help reduce strain and support a more controlled experience. Hygiene considerations also play a significant role. The digestive tract naturally contains bacteria that differ from those typically present in other intimate regions. Without proper precautions, cross-contamination can occur, potentially contributing to urinary tract irritation or localized inflammation. Simple preventive steps can greatly reduce these risks. There is also the topic of infection transmission. Certain sexually transmitted infections can be passed through anal contact, sometimes without visible symptoms in early stages. Regular medical screening and honest dialogue within relationships are crucial for maintaining trust and health awareness. Circulation dynamics deserve attention as well. During arousal, blood flow increases throughout the pelvic region. When discomfort or anxiety is present, the nervous system may activate a stress response that interferes with erection quality. Ensuring emotional comfort and mutual readiness can therefore influence both safety and performance. Pain should never be ignored. Persistent discomfort, bleeding, or unusual swelling after anal intimacy may indicate tissue injury requiring professional evaluation. Early attention prevents minor issues from progressing into more complex conditions such as fissures or chronic irritation. Psychological readiness is just as important as physical preparation. Men sometimes feel pressure to engage in behaviors they are uncertain about in order to satisfy perceived expectations. However, genuine intimacy thrives in an environment of mutual consent and respect. Taking time to discuss boundaries can strengthen relationships rather than weaken them. Lifestyle factors further influence resilience. Hydration, balanced nutrition, and regular physical activity support tissue elasticity and healing capacity. Men who maintain overall health often recover more comfortably from physical strain compared to those with sedentary routines or chronic stress exposure. Alcohol use may complicate awareness. While moderate intake can reduce inhibition, excessive consumption may dull sensitivity to pain signals, increasing the risk of unintentional injury. Maintaining clarity during intimacy supports safer decision-making. Prostate considerations are sometimes discussed in this context. The prostate gland is located near the rectal wall, and stimulation in this region may produce unique sensations for some men. However, aggressive or uninformed exploration can create discomfort rather than benefit. Understanding personal limits is essential. Communication remains the most protective tool. Partners who check in with each other regarding comfort levels, pacing, and emotional response are far more likely to experience positive outcomes. Silence or assumption often leads to misunderstanding and avoidable strain. It is also worth recognizing that intimacy preferences evolve with age. What feels appealing in early adulthood may change later as health priorities shift. Adapting behaviors to support long-term well-being allows men to preserve confidence and function for years to come. Ultimately, anal intimacy is neither inherently dangerous nor automatically safe. Its impact depends on knowledge, preparation, respect for anatomy, and overall lifestyle health. When approached thoughtfully, many risks can be minimized. When approached impulsively or without awareness, complications become more likely. Your body communicates clearly when something is not right. Listening to subtle signals, discomfort, fatigue, irritation, helps guide healthier choices. Ignoring these signals may lead to patterns that affect both sexual enjoyment and general health over time. The purpose of discussing this topic is not to create fear, but to replace uncertainty with understanding. When men feel informed, they make decisions that align with both their desires and their long-term well-being. Confidence grows not from silence, but from clarity. If today's discussion has helped you view this sensitive subject with greater awareness, make sure you subscribe for more medically grounded guidance on performance, prostate protection, circulation health, and confident aging. And if you want to learn about the daily habits that naturally strengthen pelvic circulation and support stronger erections over time, watch the next video appearing on your screen now. Taking proactive steps today can shape how you feel in the years ahead.